California is now reporting the most COVID deaths in a single day since the pandemic began. Coronavirus cases are taking over hospitals, and that is definitely true in our region. So Kyung-la has a look inside El Centro Regional Medical Center, where they are seeing cases explode beyond its walls.
Oh yeah, it's generally weak. She said she couldn't even get out of bed.
When folks say, hey, it's a war zone, well, a war zone of what? A war zone of us trying to combat the COVID-19.
The front line in this battlefield.
Just craziness still.
Anybody else sick at home?
Southern California's El Centro Regional Medical Center.
This is intense.
Did you get the rest of her vital signs?
CEO Adolph Edward is a former Air Force officer and Iraq War vet.
I have seen this tent actually deploy with me when we were in Balad, when we were in Iraq.
Now he's built them on American soil
Just put pressure right there.
to handle a crush of COVID cases his hospital no longer has room for. Air-conditioned tents in the triple-digit desert heat to handle patient after patient. El Centro is in Imperial County. It sits at the U.S.-Mexico border. This rural community is 85% Latino. 1 in 4 live in poverty. Per capita, it has 3 times as many COVID cases as Los Angeles, and the death rate is the highest in California.
Is it crazy to you that you are a physician working in a tent in America?
Yeah, it's incredible, isn't it? Yeah, we'll make it through.
Inside the hospital,
It is exhausting.
we visit the sickest patients in the ICU.
She's a new patient.
Yeah, so she'll be a new patient. She's a transfer from the regular floor.
Every single patient in this 12-bed ICU has COVID. 11 of them survive with ventilators.
Can you explain what you're wearing?
Well, it's a device that helps keep everything, kind of like closed so we're not exposed to anything.
It's what nurse Amber Mares needs to wear to stay safe while helping her 40-year-old patient.
How sick is he?
He's really sick and he's really young, so we're trying to do everything we can before we intubate him.
What is that suggesting to you as a nurse, that the age is dropping?
I think that a lot of people aren't honoring like the stay at home, a lot of people aren't doing the social distancing.
That's what the El Centro Fire Department sees on the street.
El Centro Fire Battalion.
The battalion chief says in this town of 50,000 people, every single hour it is this.
There's a possible COVID patient on scene. So at this point, our personnel are gearing up for a COVID patient.
In a full hazmat suit, Captain Chad Whitlock revives an unconscious patient. It's a stifling 110 degrees.
We have to decon all the equipment and remove all our uniforms and take a shower and put a different uniform on for the rest of the day.
You're dripping.
Yes, ma'am. We're inundated. Everybody's really tired and you can see it in my face, we're frustrated.
That patient Captain Whitlock saved arrives at El Centro Medical's emergency room.
We've hit capacity. We've transferred out 2 or 3 times the normal amount of patients that we're sending out. I think in the last 2 months we sent out something like 500 patients.
Some to nearby San Diego, others as far away as Northern California. This helicopter is here to pick up another patient.
Get started in there because they're here for him.
ER doctors and nurses intubate under this blue drape to limit particle exposure. Stabilized, the patient heads out.
Why is it happening so badly here in Imperial County?
There are a lot of U.S. nationals that live in Mexicali. They had a really bad outbreak there. There's a lot of people that cross the border here for work, that live in Mexicali and then come and work here.
The fields in Imperial County send produce across the country. And even in a pandemic, some 20,000 Mexican day workers enter legally every morning to provide the labor. No work, no money for food, says 65-year-old farm worker Jacinto Moreno. 4 of his fellow farm workers have died of COVID, he says.
We cannot win a war on COVID in the emergency room. Look at the big picture. We need to fight the war on COVID where it's breeding, and that's our neighborhoods.
In this binational county, COVID is not the disease, it's the symptom.
They experience social determinants of health, like putting food on the table, like having to work in dangerous conditions, like not having a mask. We are the poster of those inequities and the reason why we're not able to control COVID.
The hospital here is bracing for what's yet to come. This empty tent is the future COVID ward.
Is this tent a sign that this pandemic is here to stay?
Yes, so I keep telling folks, look, now it's a pandemic, eventually it's going to be an endemic, so is this really how we want to take care of our communities? And the answer is no.